Right, my name is Hannah Hoyne. I'm a consultant psychiatrist and professor of psychiatry and editor of Global Psychiatry Archives. This paper is quite interesting and has been written by a colleague who is working in Britain and also working in Pakistan. And it's about the perception of Pakistani community towards their mental health. So he made a quite consistent and inventive, systematic review. And the idea was how to find out what is the understanding of Pakistani community on mental health. So this is about, culture, perception of mental health, and approach about sociologies to understand mental health. I don't want to go into detail, but I would recommend to you read this paper. It has been downloaded quite a few times already from the website of the journal, and you can do that as well. So there was a literature research strategy which used PubMed and Google Scholar and Cochrane systematic review databases, and there were different terms: Pakistan, Pakistani mental health, perception, etc. So Google Scholar brought up many papers, and eventually the papers which were included were papers which had some internal validity and external validity, and they are summarized in the table. And I don't want to go into this. So papers that have been followed observational and intervention design, study design, and and then authors should give some information about the understanding of what the Pakistani community understands about mental illness. Right. Different studies were included and excluded. I don't want to go into different details. What I would like to say is that what was very important to this author is the philosophical underpinning of the research. What type of methodology was used? Is internal validity there? External validity? Can the results be generalized and can they be confirmed? So that's what they went for. And the outcome of these research where they had 23 studies, and in total with PubMed were 71. And then after excluding the ones which didn't fulfill the full criteria, 19 were included. These are in the table. We come to this in a second. And the question, and what's very important, is that there is an overall very, spiritual and religious understanding of treatment, and supernatural perceptions are very often identified by researchers as one major cause of mental health problems. So if you go to some of the studies, you see that some of the studies looked for the treatment by by religious healers, and people felt that to some extent religion was or wasn't an impact. Interestingly, some studies provided some information about the religious healers who should be contacted in treatment. And some of the studies, the one by Tarayan, I'd like to mention. Maybe look at the study at Mirzan, 2006. So healthcare providers which are identified to treat with mental health problems are GPs, religious healers, hakim, homeopathic doctors, and face healers. So that's what people would usually, or to some extent, go to treat something which people are perceived to be in the spiritual world. Some of them recommend different types of, I think that hopefully come to this, to tea and tabassum. This is a study, and there were attitudes were looked at the different population which were in the city, and some of these patients, they said that traditional healers provide treatment. And there was a bit of a mixture in the more city-like and more females. Astonishingly, they were more interested in doing more or less Western or classical psychotherapy. The other thing is that, and this is quite unusual, that in some study, that treatment, so that some of them, in a small minority of cases, physical beating was used as part of the treatment process. So that was lots of religion, lots of spiritual healing, and some beating as part of the treatment. So I think this is something we wouldn't really recommend at the moment, but I think things are changing, and when you look at the newer studies, you can see that there's some more modern and, let's say, psychotherapy-focused opinions come through. Anyway, so these are quite interesting studies. I would recommend you read the paper. I think religion, faith, and culture plays a major role in the understanding of mental health problems in Pakistan. Spiritual reasons are given. There's some understanding that different, and this is what I'd like to show here, that evil shadows can affect the person. Then churai is used in the same meaning as witchcraft. Jinns are ghosts who can have a negative impact. Itzad means honor and is used in different meanings. So a peer is the name of face healer, and fakirs as a wise person who might help with healing. Right, so sannyasis, amir are people who have magical methods and made help. And so there's shamanic treatment. So possibly it's not just the same in every place. I think inter-Pakistani differences in culture play a major role in what type of religious healer is looked after or looked for. I think it's quite interesting, and it's also quite interesting in some studies, can't cite the name of this, that also some people living in the UK would want to have a religious healer to deal with their relatives' mental health problems. Another thing I'd like to mention is that what we currently in the West have as DSM-4 or DSM-5, where all the verbs, all the words and mental health problems are defined. Some of the words don't exist in the Pakistani culture. So some of the names, or let's say understanding of mental health problems or expressing mental health difficulties are possibly not whatever developed or part of the culture of this country. So quite interesting. I find it. I think it's different. Doesn't see it's. Wouldn't want to say it's worse or anything. I just want to see it's very different, very much culture based, very much spiritual based, and a very much different understanding from Western psychiatry. But this is what Global Psychiatry Archives wants to show. We're not all having the same assumptions, and what's better needs to be shown. And I think some wise psychiatrists said we shouldn't just put the Western model on everybody, but we should also say learn from people in the developing world, and maybe some of the spiritual meaning which we should look at might be lost in the West. If you really want to look at this paper, please look at the website www.globalpsychiatry.co.uk. You can download the paper as a PDF, costs you nothing, and the only thing you can win is some insight. Okay, that's us, and I wish you a nice evening. And if you want to get more information such as this, then subscribe to our YouTube channel. Okay, thanks a lot and have a nice day. Bye-bye.